All right, Dr. Rubenstein, I'd like to talk to you about gum disease. And actually, the thing about gum disease I want to talk to you is, tell me how wrong I am or how maybe right I am here. Most dentists, when they talk about gum disease and the future implication it may have to the patient, they talk about losing your teeth eventually. Now, it's a bad thing. And however, at the same token that it is a very bad thing, you dentists became very, very good with replacing teeth, implants, crowns, bridges, even dentures, which are implant supported and really quite goddamn good. So you guys became good at it. But the problem, of course, it costs money. So avoiding that for most people is not a bad thing, I suppose, because that money can go to get you to Hawaii or to something. The point, however, is this: while the gum disease is going on, until you lose your teeth, which may be 1 year, 4 years, 3 years, 6 years, whatever it takes, things progress different with different people. Okay, during that time, the person has an infection in his mouth, an infection which is huge, which is at the gateway of the blood vessels and which ruins his liver, which ruins his kidney. We have heard about heart problems with it, the arteries clogging up. We have heard about Alzheimer developing. The immune system is brought down drastically, never mind the stinky mouth. So that type of things, if that happens for 1, 2, 3, 4, 5, 6 years, still you lose your teeth, wouldn't those organs be much more difficult to fix afterwards than the missing teeth? So basically what I'm saying is the other problems it causes are much more severe than the goddamn missing teeth, which I'm not saying it's not a problem in itself. Now go ahead and give me your viewpoint on my thinking here.
Well, I think that my viewpoint is somewhat similar and a little bit different than yours, because the field of understanding in periodontal disease has changed somewhat, and two is that we now have ways to sort of maybe get ahead of the curve. Periodontal disease is changing as we speak as to what we think is causative, because the object is that, assuming all things being equal, if you had a healthy mouth, if you could keep it clean, if you could lower the bacterial counts and viral counts and whatever other schmutz is on your teeth and get the food off, the hope would be that if your genetics are okay, that you would be able to maintain your teeth, the bone, and keep disease out of your body. So it's up to you to get your teeth clean regularly, and for you to sort of daily take good care of these teeth in order to chew, and which allows you to eat well and maintain your overall health, let alone the fact that if bacteria is building up and is getting into your bloodstream, because it's very easy to push it in there from bleeding gums and everything else, that essentially you're diseasing the rest of your body, which we've seen in heart problems and other various things. So the answer is, if you come in and you're examined and we find that there are areas of deficiency, or your whole mouth is just overwhelmed with bacterial plaque and tartar and stuff like that, the answer is that you need to have your mouth adequately cleaned and monitored. And this may mean that you're doing this, not necessarily deep cleaning several times a year, but that you get your teeth really well cleaned, and then we see you several times a year to make sure it's being maintained. And sometimes you'll need some gum surgery to get stuff, the gum has to be taken out of the way to get to clean this, and then we have to see how well you maintain, and if everything is holding status quo, hopefully, you can go along and reach a point of normal balance, and we can keep your teeth for, well, hopefully you can keep your teeth for the rest of your life. The answer is, sometimes genetically things are against you, and perhaps it would be better, oddly enough, because the teeth are the area that the bacteria are gravitating to hold on to actually get rid of the teeth. Replacement with the implants is better if you have a lot of bone. If you have periodontal disease, you can destroy a lot of bone if you don't treat it, and therefore your chances of having implants get less, And if you have no teeth and are wearing pieces of plastic, you're not going to be a happy customer or a happy camper, so to speak. But essentially, the answer is that I think people tend to they come in with problems. They don't really understand how bad it is, and they really need more cleaning, and they need to do their maintenance at home. You know, brushing and flossing has some necessary benefits, and that's really to your overall health. And so if we can reach this homeostatic position and you're willing to participate, then I think that you have to understand that you're going to need, maybe it takes 4 visits to clean, you know, the 4 sections of your mouth. You may have to be numb. And it's extremely important. I think, you know, it's the same thing. If you come in and I examine just your teeth and your gums and you have some sort of cancer that I'm not looking for, well, doesn't make any difference if you die, you know, 3 months later from the cancer if I cleaned your teeth. So I think that we try to, when you come in for an exam, we try to examine all parts of you, soft, hard tissues, and so periodontal disease is, assuming that you're a healthy person, is a very good thing to get under control. And I think that people have to understand that they may have to undergo a lot to try to get back to that position.
Right. So I absolutely I got that. So shed some light on, however, on a basic question. If a person has gum disease and doesn't fix it, and it keeps growing, you know what I mean, and he just kind of says, well, it's all right, I'm bleeding, I'm this, I'm that, but you know, the doctor says, oh, in 1, 2, or 3 years you might be losing your teeth, and the guy goes, well, maybe in 2 or 3 years I'll fix this thing, don't worry about it, or I'll fix it next year, but he keeps having this gum disease. Is he, by doing so, having this infection in the mouth, is he lowering his immune system? Is he risking his kidney? Is he risking his liver? Is he risking the increase of diabetes even growing? Is that all going on in the meantime? Yes or no?
The answer is yes. I mean, you have an inflammatory, maybe focal infection within your mouth, but your mouth, oddly enough, the blood vessels are connected to the rest of your body. So if, I mean, this bacteria is going to travel around. Now, it doesn't mean that you don't have resistance and that, you know, I mean, if you took a swab of somebody's mouth, there's probably 200 various bacteria. We used to think it was 10 that was the causative scenario. I think that with biofilm understandings, we don't know. Could be a virus, it could be a fungus, it could be any number of 200 bacteria. The answer is that if everything is held in abeyance and you're doing what you can and your body is okay, the answer is you'll be okay. But the answer is if you don't treat it, other parts of your body definitely are going to be infected.
It's a little bit like with, let's see whether that is a good analogy here. It's like with war. You have X amount of soldiers. Let's take the United States, and you know you're involved in one war in Afghanistan and another one here, and then you want to start another one. There comes a time where, well, there's only so many soldiers you have, and your overall system starts breaking together. If a new war starts, you're done. Or like with fire, you know, you have so many firemen. If there's 3 fires going on, fine, maybe we can handle that. What about a 4th one? So you have all those infections going on. There is resistance there. But what about the next flu season, which will come? And what about this and what about that? Your body has only so much defense system. Different bodies have different ones. Some have higher, some have lower. Fine. But whatever the body has, with a gum disease, you are taking away some of the soldiers needed to fight that infection in your mouth. That's what you're saying, right?
Well, the answer is I think that you have one war going on. If I had that many going on, I mean, the answer is you could have various places in your mouth that have problems, and you have to deal with maybe sometimes just a few areas that are in different spots. But the answer is that if you have a lot of disease in that particular spot and you don't go fight the war, the battle's going to be over within a relatively shorter period of time than you think. So, but the person who comes and we're explaining this to has to decide that they're going to take action. If they don't take action, well,
So basically, you need to get rid of your inflammation. Whether the inflammation is in the lung or whether you have inflammation in your toe because you stepped on a rusty nail, one way or the other way, you got to do everything to take it away. And people would, if people have an inflammation on the skin on their hand here, big like let's say a quarter, they would probably, if it doesn't go away within a whatever short time period, they would probably go to a dermatologist very fast, as they should. But they're not quite doing that with a gum disease as fast and as readily. Have you noticed that?
Well, I think that many people, from smart and not so smart and rich and poor, have no understanding of exactly what's going on in their mouths and what the consequences are. So I think that if you get some understanding of what we're trying to accomplish with, trying to fight the disease and prevent it, then the answer is that if you're going to join into taking care of yourself, you join the fight. But we try to present the facts as we see them. Some people come in and they tell me their gums are bleeding and this, that, and the other thing. They're having pain. They're swollen. I mean, they have already far-reaching effects of this. And the answer is, here's the treatment. And the question is that if you follow the treatment and everything works out, you should be able to take care of this and resolve it before this happens. So, I mean, the answer is if you're essentially healthy and the genetics are not against you, it's a beatable type of disease, but you have to participate in, attacking it, treating it, maintaining that the fires stay quiet, and, then you'll have a healthy both mouth and hopefully body and everything else that'll follow. If you don't, then, all bets are off.
Right. Well, I hope that this particular conversation with you helps the people listening to it to realize that, boy, you better do something because it damages much more than just losing teeth. It damages many other organs of your body, which in itself are very difficult to fix once they are damaged. Thank you very much.
Thank you.